Welcome to Business Connection. I'm Liz Spencer. We're on location today at the Edward Cancer Center in Naperville. Joining me now is Jenna Van Gilder. She's the Administrative Director here for Cancer Services. Jenna, we're at the Edward Cancer Center. Some of us may know it personally or not at all. It seems to be that way. So tell me a little bit about the center.
So hopefully you don't ever have to walk in these doors, but if you do, I think this Cancer Center is really a hidden gem of the Naperville community. We've been here now 10 years. Our goal here is really to provide that level of comfort for this community, to let them know that we're right here. We can treat you. You don't need to travel to an academic center, because really we provide all that care, and I think more, because we have a personal touch. A lot of times you hear patients say when you go downtown, it's a big center and you may become a number, but here you're our family, and we want to take care of you every step of that way, making sure that you have the support you need to get through and get yourself on your way. We want you to think as little as you can about treatment and as much as you can about everything else you do normally.
Well, I think that's really important. I think people don't want to travel. It's a shocking thing, and you don't want to have to travel down there, and now we have it in our backyards, and that's great.
Yes.
Tell me about some of the support services that you do.
Right away when a patient comes in this door, they meet with one of our social workers, and they really introduce them to all the different things that we offer here, whether it's just one-on-one counseling, or you want a support group, or you like to do yoga, you want to meet other people with the same diagnosis, mindful meditation, all sorts of healing arts. We have pet therapy, which everybody loves to see the dogs.
Mm-hmm.
That social worker kind of sits down with that patient and just tries to get to know them and make sure they know about the services that will benefit them here.
So tell me a little bit about the navigators.
They're all advanced practice nurses, which I think is really great. So they can actually see patients independently when they need to be seen, and a physician may have a busy schedule, so that's really nice. And they try to develop that relationship right from the beginning with patients. After a physician sits and talks to the patient, they then actually see the nurse practitioner to review education, things like that. Because like you said, it is a journey and it can be overwhelming. A lot of times initially you're in shock, you might not hear everything, and so we want to make sure that you've heard what we have here and that you're utilizing all the services we offer.
Well, it is a scary time. You have a team of care specialists,
yes,
of medical experts in that. Tell me a little bit about that.
Sure. So we have the full array of medical oncologists, radiation oncologists. We have pathologists, radiologists. We just added a surgical oncologist who is really innovative. He's been here now a year, and we're really excited to have that here in the community. And he offers surgery for complex cancers, something that we typically weren't doing, and it's been really, really nice for the patients. Again, another reason that they don't have to travel downtown.
Jenna, we're going to go learn a little bit more about high risk and genetic counseling and treatment here at Edward. Joining me now, I have Elise Weber, and you're a genetic counselor here at Edward Cancer Center. We hear that word genetic counselor, and I don't think I know what it is. I think that you might work with both people who have cancer and those who might be at risk.
Correct. So genetic counselors, we're master's trained medical professionals, and our goal is to help patients and their families understand the genetic implications of diseases. So in this case, understanding the hereditary component to cancer. And how we go about identifying those individuals who do have gene mutations that predispose them for breast cancer and other types of cancer.
You mentioned breast cancer, so tell me a little bit about how the genetic counseling plays a role in that.
When we see women with a striking personal history of breast cancer, diagnosed very young, or with a very strong family history of breast cancer, we know that those are women who are potentially at much higher risk of developing additional cancers, whose family members, their daughters, their sisters, may carry gene mutations as well that increase the risk for cancer. And identifying those individuals will, with these mutations, will allow us to identify who within that family would benefit from earlier surveillance, from risk reduction strategies, and it gives them an opportunity to learn the pros and cons of surveillance versus risk reduction, so that they can come up with a solution that is appropriate and something that they're comfortable doing.
And so you're working with all the family members?
Yes, absolutely. Sometimes the first person in the family I meet is the person who has cancer, and the results will then yield information about other family members. And if those family members wish, they come to our high-risk clinic here. They meet with me, they meet with our physicians to discuss the likelihood of them having a mutation.
Wow, that's wonderful, and to have it here locally is even better. So thanks for joining us and telling us a little bit about it.
Thank you.
Jenna, one of the cancers we hear most about is breast cancer. How does Edward Cancer Center work with breast cancer?
Unfortunately, really, even in Illinois, we have actually known to have a higher incidence of breast cancer in Illinois, and we actually have a very large population. So we are really focused on breast cancer here. We have coordinators that are nurses that meet with the patients on the radiology side. So when you're just going in for that mammogram, if they end up saying they want to do an ultrasound, they're really there to support you. 99% of the time, those are negative, but they're there to make sure any fears you have, that they're there to support you through it. And then we have a breast navigator on this side who's an advanced practice nurse who meets with patients, reaches out to them right away when they're diagnosed, and is there with the patient every step of the way.
One of the exciting things I think happening here are clinical trials. First, tell me a little bit what a clinical trial is and how it works.
We really are focused on providing that innovative treatment here in the community for patients. So clinical trial is really where a patient is actually looking at drugs that have already been tested and we know they're proven to work, but maybe they will be going on a different arm to test an additional medicine that could actually even be more helpful. Patients who participate in clinical trials are really soldiers because they are really actually making sure that next person who comes with breast cancer actually has those advances and finds out about different treatments that could be a cure. Here we look for the population that we treat, try to find clinical trials that are going to support them. We have a sarcoma provider here, and we have a clinical trial that we're only one of 5 in the United States that has that trial, and we have patients from all over the Midwest actually coming here to be treated with this clinical trial. So we want to make sure we're offering things that might not be in the general area that are going to support the patient's population.
For those who already have cancer and say, okay, I'm going to do this too. Wow.
Yes, one patient here actually in particular I can remember who told me if it wasn't for clinical trials, every time her breast cancer recurred, there was a new drug. And she's here 15 years later. And so really, again, it's because of all those other people that participate in these trials that every time her cancer recurred, there was something else.
One of the things when we were touring earlier that I thought was really helpful was the bell. Tell me about the bell.
So we have a bell here that we like to ring a lot, whether it's the end of a treatment cycle or it's you're leaving us for good. We want to ensure that everybody gets to ring that bell. It's a happy moment. It's I'm done with radiation. I'm done with chemotherapy. And we celebrate. It's just a fun time. It makes everybody smile, and it's nice for the other patients too. We make sure, from the minute you're diagnosed, you're a survivor. Unfortunately, some patients are treated for many, many years, but we always make sure everybody gets to ring the bell and ring it often.
That's wonderful. Thanks for sharing with us, and I can tell just sitting across from you how much you care about this, and
I do.
and that you take cancer and make it a little less scary. So thank you.
You're welcome. Thank you.